The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Good evening. Magandang gabi po sa inyong lahat. Mayong gabi sa inyong tanan. Naimbaga sa Ardam. I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. And here we are again on a Monday night. Maraming salamat po sa inyong pakikinig sa aming programa at patuloy na pagtangkilik ng Healthy Mondays. At alam niyo bang pilit naming pinapaalam sa inyo ang maraming impormasyon para kayo ay maging malusog. At ang maraming impormasyon na ito ay minsan nga ito din ang aking paraan para malaman ko ang mga bagong balita at update with healthcare conditions and treatments because I have to research them. And so we have heard for the past 2 Mondays about men's health Awareness Month, and ang buwan ng Hunyo ay isa na rin na selebrasyon na kakaiba sa lahat ng episodes namin. Although we did have a guest during our anti-Asian hate crimes, Matthew Dang, who is a elementary school teacher, and he happens to be leading the Nevada Queer Society. He shared some of his struggles in being an Asian gay male. So, this month is also, besides Men's Health Awareness Month, it is also Pride Awareness Month. And so let me give you some history about Pride Awareness Month. This month was created with the intent to encourage openness and education about LGBT history and rights. And I will share what the letter stands for in a few minutes if you don't already know. June is celebrated as Pride in honor of the Stonewall riots. Though Pride events occur all year round, it also marks the month that same-sex marriage was legalized in the United States. Pride Month is also an opportunity to peacefully protest and raise political awareness of current issues facing the community. Parades are a prominent feature of Pride Month. They also have convention here in Las Vegas, and there are many street parties, community events, poetry readings, public speaking, street festivals, and educational sessions, all of which are covered by mainstream media and attracting millions of participants. Pride Month is important because it marks the start of huge change within the LGBT community, as well as the wider societal implications. Although attitudes and injustice remain, we have come a long way since the riots of 1969. And by continuing this long-standing tradition, we continue to raise awareness, improve the attitudes of society, and encourage inclusiveness. That's the key, include everyone. As a true Christian, I love them and I support them with all my heart. And the lesbian, here's what it stands for. The lesbian, gay, bisexual, transgender, queer questioning intersex, or LGBTQI community represents a diverse range of identities and expressions of gender and sexual orientation. In addition to these identities, members of the community are diverse in terms of race, religion, ethnicity, nationality, and socioeconomic class. And you know, there's a lot of Filipinos who belong to this community, as well as Native Hawaiians, because I grew up in Hawaii and I know it. According to the National Alliance on Mental Illness, or NAMI, this intersectionality, the combined and overlapping aspects of a person's identity, brings diversity of thought, perspective, understanding, and experience. This complexity is important to understand as a unique and valuable aspect of the LGBTQI community that can result in a strong sense of pride and, most importantly, resiliency. There is a strong evidence from recent research that members of the community are at a high risk for experiencing mental health conditions, especially depression and anxiety disorders. LGBT adults are more than twice as likely as heterosexual adults to experience a mental health condition. Transgender individuals are nearly 4 times as likely as cisgender. These are individuals whose gender identify correspondence with their birth sex, individuals who experience mental health condition. While belonging to the LGBTQI community can be a source of strength, it also brings unique challenges. For those who identify as LGBTQI, it's important to recognize how your experience of sexual orientation and gender identity relates to your mental health. So tonight, we have a very special guest, my friend and colleague from the Substance Abuse and Mental Health Service Administration Minority Fellowship Program at American Nurse Association. And he will share with us some insights to keep our LGBTQI community and families healthy, mind, body, and spirit. So allow me to introduce tonight's guest by reading his short bio. Austin Nation, PhD RN, is a graduate of the University of California in San Francisco School of Nursing, Community Health Systems. He has been a nurse for over 35 years and is currently an assistant professor in the School of Nursing at California State University in Fullerton. Dr. Nation completed both the Minority Training Program in Cancer Control Research, or MTPCCR, as well as awarded the California Pre-Doctoral Program and Sally Casanova Pre-Doctoral Scholars, completing summer research internship at both Yale University and Duke University. Dr. Nation was also a fellow in the Black AIDS Institute's African American HIV University Science and Treatment College and was the recipient of the CSU Chancellor William Randolph Hearst Award and the Graduate Assistant in Areas of National Need, Clinical Teaching, and Research Scholar Fellow. He is actively involved in a number of professional organizations, including Western Institute of Nursing, the Association of Nurses in AIDS Care, and National Black Association. And he has been doing HIV prevention education for over 20 years. And his past research interest was with understanding substance use and HIV among young Black men who have sex with men, and funded by the Substance Abuse and Mental Health Service Administration, American Nurse Association Minority Fellowship Program. He is currently exploring LGBTQ healthcare and mental health care access in Orange County. Without further ado, welcome Dr. Nation to Healthy Mondays.
Pride. That's the first thing I want to just say to everyone. It's such an honor to be here with you to celebrate this momentous month and our history. So thank you for inviting me.
So, Dr. Nation, please share with us your humble beginnings or whatever information you want our listeners to know about you.
Well, I think it's important to know, obviously I'm a member of the LGBTQ community and have been all of my life. It's interesting that the season that I'm in right now is probably one of the most open seasons that I have probably ever been in. Just almost seems to get better as I get older, so to speak. Which isn't the case for a lot of LGBTQ folks in terms of their ability to be out and open with who they are, where, in all places and spaces where they hang out. And so for me to be able to find this freedom is so incredibly important on so many levels. And it has really changed a lot of how I walk through my life and, how I'm able to now share my story, use my research background, and have all of these things come together beautifully to advocate for members of the LGBTQ community in terms of our healthcare needs and sort of the disparities, as you mentioned, that exists within our community, that there's someone out here that's exploring that and someone that's caring about that area of research, particularly for me, in communities of color, where I think the disparities within the LGBTQ community are even higher.
I think if I may say, they always say, "Oh, you came out of the closet," right? You hear that a lot, and I think we have come a long way with accepting this new, I guess, revelation of a lot of people who have been hiding in the closet because they're afraid to be judged, especially in the Christian community. And I know I shared earlier, as a true Christian, you need to embrace them and love them for who they are. And I think what I wanted to know is your role as a professional nurse in increasing awareness about LGBTQI community.
Yeah, well, it's nice that I get to wear a couple of hats, right? I consider myself a nurse scientist, most importantly, so that I'm contributing to the body of knowledge around issues that are relevant to the LGBTQ community. And I also consider that role sort of as an advocate in terms of not only doing the work that I get to do and sort of hearing about people's experiences within my community, but then figuring out where change is needed, what we need to do to improve the lives and the health of people that are in the LGBTQ community, where the problems exist, remedies that we can possibly take to improve people's health outcomes. And I think I am positioned beautifully to be able to carry that voice and sort of share my research with everyone, not only among healthcare providers, which is probably the most important place that I get to advocate for this information, but in so many other forms. Particularly for me, when I get to talk to healthcare providers and I get to share my understanding of what I've discovered through my work in terms of these disparities and how LGBTQ individuals are being treated or mistreated within our healthcare settings, right? Their ability to be open with who they are, to talk openly and share freely about what's going on with them in terms of their gender identity, their sexual orientation, things that as healthcare providers, it would be important for us to understand to really be able to provide people with the most comprehensive level of healthcare, but oftentimes people are afraid to share that information, or as healthcare providers, we don't ask, or we make assumptions about people based on their appearances. So there's a few things that could be at play that I get to advocate for on behalf of really sharing this information with people about how we can improve our cultural competency in terms of working with members of the LGBTQ community.
I can share, I always like to tell stories. When I was a new nurse I remember it was at Ku'ukini Medical Center, my first hospital where I worked as a new nurse. And there happened to be a transgender patient who was in a quad unit, unit. Meaning that there's 4 beds in one room, and this individual happened to be still in transition of sex change. So his sex organs is still not changed. So we put the patient in a female quad because that's what she had identified herself. But it was kind of, as a new nurse, I was very uncomfortable having to hand over a urinal. So I was trying to wrap around my knowledge around it, and I think that's one of the struggle for our new nurses who have not been exposed to such situation. So can you share with us some challenges that you faced and facing related to providing care for LGBTQI community?
Yeah, and thank you for that example. That's actually a beautiful example that you shared, because I think it starts for me with acknowledging people and the way that they identify themselves. So I think you're in terms of your identification, to say, yes, this was a person who identified as female and should be placed in an appropriate setting for women, right? And this is what we should be doing, right? Of course, the challenge can be, as you said, for us to then understand that for a trans woman, the healthcare needs that would be appropriate for that trans woman are going to be different than cisgender women. And so that's where I think we have a little bit of disconnect, or actually a lot of disconnect in terms of our level of understanding and our level of education and preparation across the healthcare disciplines and how to navigate those kinds of uncomfortable situations for folks. They almost should be commonplace when we talk about LGBTQ community representing roughly 10% of our population. I think to myself, African Americans representing about 12%, 13%. That's not that big of a difference. And yet we do a lot of education preparation in terms of disparities within that community as part of our educational process. Yet we don't have that same level of preparation for LGBTQ individuals. So there's a bit of a disconnect. So there's much work to be done. And I think that the place of starting with how they identify, second place is in asking people their preferred name, their preferred pronoun. I think that's the second place of warmth and acceptance that we can all do for individuals. And this isn't just LGBTQ individuals, which is of course what we're talking about today, but I think we should be doing this with all of our patients. I mean, I think about my legal name versus the name that I go by, Austin. That's not my legal name. So when people call me by my first name, that's not my preferred name. So I applaud healthcare institutions and organizations that are listing options for those of us to ask people those questions and for us to ascertain that information as part of the assessments that we're doing so that people can be identified and called by the names that they prefer to be called by, much like the pronouns that they choose to be identified by. We should recognize and honor those as well. As healthcare providers, that's a great jumping off place. And then I can go further and talk about, as you talked about earlier, some of those disparities that exist within our community. Well, from my research, what I understand is that many of our LGBTQ folks have problems finding physicians who are competent to deal with those issues, who are sensitive and understand how to navigate those healthcare concerns. So, for example, in the example you gave, where you're talking about a trans woman, it would be important for us as healthcare providers to, one, do a sexual health assessment, which I think most of us would say we learned very little about. So we are uncomfortable talking about sex. Even I think we do a systems genital urinary assessment. We don't talk to people frankly about sex and sexual risk behaviors and those kinds of things, which provide us a lot more information about an individual, which I would love for us to begin to normalize, because with that then comes risk that can also be picked up that we can then begin to treat and respond to. So, for example, your example of this trans woman, we would need to understand that, this is obviously someone who has not had sexual reassignment surgery, has chosen not to. That again is a choice for folks. Everybody will not go down that route. But then with that, we need to understand that they still will have their biological organs that they were born with. So they would still need to have prostate exams if they're of a certain age, right? There's certain risk factors because biologically still they're dealing with the body that they were born into. And so we need to be able to take care of those things appropriately once we have gathered all of that assessment information. And so these things will become critical for us. And having providers that are knowledgeable, comfortable, and confident in dealing with individuals who have these kinds of issues that are going to fall outside of what we normally deal with in healthcare.
You made a very important point. I think it's about time for us to look into our curriculum, especially maybe our health assessment. And you mentioned earlier the physical assessment, it's already there, it's embedded in the training of our new nurses. However, I think the psychological part of it, even the most experienced nurses are discomfort, or they're uncomfortable to ask about sexual behaviors unless unless the patient or the client has been identified as risk for having a sexual transmitted diseases or infections, right? So I think it's about time, and I agree with you, we need to incorporate in our training to expose our nursing students to start asking important questions such as, and it's also identifying how can you communicate with them, because that's one of my question, and how would you what are some suggestions or facts or what not to say to a member of the LGBTQI that might offend them? Sometimes we just kind of, what they say, put our foot in our mouth because we said something and we didn't realize, oh my gosh, I should have not said that. So can you give us some suggestions, especially for our listeners out there who are not familiar with the community?
Well, no, that makes sense. And obviously, my word to folks would be, don't be afraid to make mistakes, right? Because that is inherently a part of just being human, right? That we're going to perhaps say the wrong thing. And hopefully that individual that you maybe misgender or use incorrect pronouns or wrong name will then do a gentle, soft correction. That's what I also encourage people in our community to do when they're accessing healthcare services. The other thing that you're bringing up sexually transmitted diseases as sort of a reason why we would ask sexual health questions, but I think it goes much beyond that. We're in an era where we're talking about issues around human trafficking and all kinds of things, and these disparities actually hit members of the LGBT community also disproportionately. But it's important for all people to be asked these questions because we want to be able to do assessments in those areas so that we can figure out if there's a problem that warrants further investigation or treatment or reporting, right? We need to be mindful of that. And I think I dream of the day that we can begin to normalize that and those questionings, much like in our society, we sexualize everything else in our society. But when it comes to talking about it in really what I call a sex positive way, people become very challenged in having those very honest, forthright conversations. It's like we all know people are doing it, but we're afraid to talk about it. And whether you think you're at risk of something or not, oftentimes there can be shame attached to that. So again, that's why as healthcare professionals, or particularly as nurses, where they say we're the most trusted profession, people will disclose things to us if we ask the right questions, right? And they'll be able to step out of that fear. And again, if we're normalizing that as part of the rest of the assessment that we're doing with individuals as we're gathering all of that information, it would be so incredibly helpful. The other thing I would want to mention is I am aware that there are people in the community who are still being subjected to issues like transphobia, homophobia, mistreatment, and abuse that continues to be dealt by the hands of healthcare professionals. And I'm really at a loss for us having that kind of extreme bad behavior with any individual, particularly because, in my understanding of what we do, we're here to help people. Help all people, right? We don't necessarily get to choose the people that come into our care, but once they are there, then we are to care for them in the most humane and dignified ways possible, regardless of who they are. And the fact that there would be healthcare professionals out there that are doing those kinds of extremes in behavior, I just find that completely unacceptable in terms of how we're conducting ourselves as professionals. Treating people with respect, just like you would not want to have people be stereotyped because of any particular type, because of their sexual orientation, race, ethnicity, or gender, or any of that kind of stuff. It would be the same with the LGBTQ community, that we give people that same courtesy in terms of helping them navigate this very, very complex healthcare system. Oftentimes for people who are already afraid to talk about what's going on with them because of fear anyway, of thinking that people won't understand where they're coming from. And oftentimes people don't. And that's fine. But those can be wonderful moments, like I said, for me to ask questions about something that I may hear somebody report to me that would warrant further questioning or investigation, or maybe it's something that I just completely don't understand, and I would share that with the individual as well. So those things become important. We want to minimize not only the bad treatment, but also the delays in service that this can also cause to folks. Because they have not been given proper assessment to be able to diagnose and treat them for the issues that they're presenting to us with.
Yeah, the LGBTQI population community are identified as a minority or high risk for health disparity, right? So I think, nevertheless, we are blessed to be in the United States because we are free to express our perspective. We have our right to be who we want to be. And I just wanted to share, because I've been traveling to Uganda, Africa every year since 2014. If only not with the COVID-19, I would have been there right now at this time. But that I just wanted to share to our listeners out there, another information is that it's actually illegal for to show affection with the same sex in Uganda, and you could be put into jail. I don't know if you know that, because when I was there, then that's what one of my friends, colleagues and professor in the university said, that people are not allowed to show affection in public there in a country, because especially where I was, because it's a Christian. Uganda is predominantly a Christian country. And so when I heard about that, I was like, oh, wow. So I think because it's going to be 4th of July next week, right? Next Monday. And I just wanted to share that we are blessed to be here in the United States. We will not be able to talk about this sensitive topic as we are doing right now if it was not for our freedom, for our right to speak, and our right to freedom of speech, I wanted to say. In November 2020, Nevada is the first to enshrine gay couples' right to marry in its constitution. And Nevada voters overturned an 18-year-old ban on same-sex marriage. And some states does not fully protect gay, lesbian, bisexual, or transgender people for discrimination. And these people could still be unfairly fired, denied housing, or be turned away from public spaces because of who they are. I know when same-sex marriage was legalized in Hawaii, I see an influx of people coming in from the community, coming in and getting married in Hawaii, and some of them stayed, and some of them I'd worked with at the institution a hospital where I work. So I have a question for you, Dr. Nation. How does that make you feel?
Well, my brain is just going 1,000 miles an hour right now. So let me back up. I want to cover a few things.
Go ahead.
I mean, obviously, it makes me excited. I feel incredibly excited that this has happened in Nevada, and I get the fact that people would want to migrate to places, safe spaces, and places where people can come and be themselves. Obviously, even here in the United States, there are parts of this country, and particularly in some of the southern states, where it's still quite difficult for folks to come out and be themselves, particularly if they have things like HIV. That's still very highly stigmatized in many parts of the United States, right? People are having to hide or go into back doors of clinics. I actually saw that when I was in South Carolina, which was very surprising, particularly when I compare that to the liberal sort of freedom that I saw in San Francisco, where everything is so incredibly open, and you can walk into Castro, the gay neighborhood, and you can find these places and spaces all over the neighborhood where you can walk into, and they're literally storefronts where there's glass there. So there's no shame to being inside of these places. People are not going in there to hide. You're sitting there very up front and very prominent in these places because you know that these are places and spaces that are important for you to be taken care of within your community, and that there are places that will accept you and that you can feel like you will get, the best care possible. We're lucky, and I'm in California, you're in Nevada. I mean, we're in probably a couple of the most liberal states around the country where these freedoms are now in place for folks to be able to find the resources that they need. But when you were talking about the criminalization of folks in other countries, and I don't want to do a heavy global conversation, but I am certainly aware of that what you're mentioning. And in some places, LGBTQ folks are being put to death because of who they are and because of sexual orientation. So it goes even deeper than criminalization. It can be outright death. And I remember in some of the organizations I worked with where we're actually taking in LGBTQ refugees from places because they were at risk of being killed simply because of their sexual orientation and nothing else. That can still be quite dangerous for folks around parts of the country. So again, we can celebrate that we have some modicum of freedom. Are we completely free as a community? Absolutely not. Absolutely not. And even as I hear you talk about the celebration of marriage in your state, I am keenly reminded, that this is still fundamentally a Christian country that has Christian values. And oftentimes in my lifetime where I would attend these gay pride celebrations, which would happen around this time of year, there would be a group of Christians, quote unquote, I'll use that word loosely, that would be out there condemning LGBTQ people to hell and persecuting them and telling them that they need to change their ways. And that kind of stuff still exists at most pride celebrations even today. That people are out there at these celebrations, and they're allowed because of freedom of speech to spout off, as I call it, that kind of hate speech. Because to me, it borders on hate. Like, go find somewhere else to go do those kinds of things. Particularly during a time that should be very celebratory, which is what these pride celebrations are all about. They're time to celebrate who we are and where we are. But I dream of the day that Christians begin to be, as myself, a sort of born-again Christian raised Catholic, begins to be more accepting really of all people on all levels. And even in places where marriage is not legal, but just for the fact that this is another human being who loves somebody else, and you love who you love, and grateful that people are able to find love, whether it's same sex or opposite sex, or people that identify as LGBTQ or non-binary or wherever you fall. That I am not here to judge anybody. I am here to love folks. I'm here to care for folks, and that's really, as I would think, that's what Jesus would be doing. And so I struggle with some of the stuff that I see still that's going on in the world. Even though we have some progress and some freedom, there's still so much work that needs to be done in terms of much broader acceptance. We're talking about Pride celebration Stonewall that happened in 1969, right? So that is now, what, 50 years, almost 50 years ago. My math isn't, about 50 years ago. And we're still, as we saw with this recent Supreme Court decision, we're going backwards in some of our freedoms. And I'm afraid, honestly, that our LGBTQ rights will start being rescinded too, much like our civil rights will for African Americans. So I'm just watching the state of this country, and it is of concern. I don't take this thing freedom for granted anymore. I don't know, as I always thought with even this recent decision of Roe versus Wade, where I thought we had made progress for women, that progress can be rescinded at any time. I'm concerned. So we still may have more advocating to do. The fight is clearly not over yet.
We have to continue increasing awareness of acceptability, inclusiveness, loving everyone, right? So you mentioned about those rallies. I think true Christian is, instead of hating, you should be praying, and you should be praying for. And you said, they happen to have someone that they love, so pray for them instead of hating them and doing all these riots. So I know when I writing something about the vulnerable population, and LGBTQ community was identified as one among the children, our elderly, women. So we really need to increase awareness about so many things. And you said that we're far from full freedom, right? And because there are still countries who are not accepting because of their culture, because of their religion, right? So we also have to look at in their own perspective and understand. And so we just learn to forgive for their non-acceptance, right? And for excluding them, and just forgive and just pray for them as well, too, that someday they will realize that what they're doing is wrong. So when time flies when we're having fun. That's my cue, Dr. Nation. Do you have any last words of wisdom for our listeners out there regarding our Pride Awareness Month?
Have fun. Celebrate. Be you.
Yeah. Can you share with us?
That would be my charge. People should take an opportunity. If what warms my heart is that I said in California, and I remember when we started some of the gay prides here back in the day, and to see them now flourish in so many of the cities. We're not just doing them in just the gay cities, Long Beach, West Hollywood. I mean, you're going LA. I went to a Compton Pride last year. I mean, the individual cities are beginning to celebrate. They're hanging pride flags for the month of June. We need to continue to move in that direction, right? And so this is our moment to sort of shine and to celebrate being who we are. And so we need to come out of the closet if we're in there and get out and celebrate, because I think once people begin to realize that they know someone who's from the LGBTQ community, right, that we're not any different than anybody else.
Exactly.
There's nothing to be afraid of. We're God-fearing people just like everybody else. We love like everybody else. We hurt like everybody else. We have needs like everybody else. Then perhaps we can begin to have an impact on these horrible disparities that are plaguing our community at such disproportionate rates. When I think of the mental health issues, the suicide, the depression, those kinds of things that are harming our community because of how people are having to live, they won't truly be free from those until they can step out into a world that says, yes, we welcome you and we love you just the way you are.
Thank you so much, Dr. Nation, for being our guest tonight. And I just wanted to share with you, I'm so proud of our university because our College of Nursing actually have a LGBTQ Student Nurse Association. And I just thought about it because last night I wanted to congratulate our class of 2022, our ABSN, Accelerated BSN, February 2021-2022 class graduated last night. We had a pinning ceremony. And I spoke for the, of course, the Apina Rasna, our Roseman University SNA. And then we have an LGBTQ SNA as well. So, wow. Awesome. That is something to be proud of, including everybody and increasing awareness of our nursing students who's going to be future professional nurses. So, yes. And I also wanted to thank PHLB Radio for giving us this platform to share important information for our community, to keep you healthy, and to give information to our families in the communities. So remember, everyone out there, our listeners, thank you again for listening to us tonight, and hopefully you'll join us again next Monday. Remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.